Obviously, every city and town is keeping a close eye on its COVID-19 numbers, especially now that schools are reopening. And test results are pretty much the only metric they have to go by. But as Cristina Quinn tells us, there's another approach that may be worth considering.
This research scientist is extracting genetic material from something we don't really think about once it's gone: poop, more tastefully known as wastewater. And in the era of COVID-19, there's a good reason to give it a second thought.
Everyone contributes to the wastewater, whether they are symptomatic or asymptomatic, whether they have access to molecular tests or not. So it's a much more egalitarian or unbiased way to survey levels of virus in the greater community.
Basically, not everyone gets tested for COVID-19, but everyone poops. And wastewater from 43 communities ends up here at the Deer Island Treatment Plant in Boston Harbor. Over the last several months, the Massachusetts Water Resources Authority has been sending samples 3 times a week to Cambridge-based BioBot Analytics to test for COVID-19 levels.
Based on what we measure today, predicts what's happening in the community, and so how many cases we will observe in 4 to 7 days. It's sort of like looking into a crystal ball in the shape of a toilet.
And McElroy says this murky glimpse into the future is one part of a multi-pronged approach to safeguarding public health, from testing to Google searches.
So if you see a trend in uptick of people Googling respiratory symptoms, then potentially you can use this as a way to monitor and plan for a more active public health intervention.
Like preventing an outbreak. Research has shown that people infected with COVID-19 start to shed the virus before they experience symptoms, which is why Cambridge is using BioBot's wastewater data as one of its 3 metrics for reopening its schools for in-person learning.
There hasn't been much guidance from the state, and so we knew that, and we urged our superintendent to rely on the experts who are doing this work and not to wait for the state.
Cambridge Mayor Sumbul Siddiqui is also chair of the school committee and says connecting with the city's community of scientists and public health experts was a natural fit.
It's about following the data, following the science.
The Massachusetts Department of Elementary and Secondary Education didn't respond to GBH's request as to whether the agency is considering wastewater epidemiology as part of its guidance for reopening. But as testing continues to have its issues, this may be Poop's moment to shine.
Cristina Quinn joins me now. Poop's moment to shine. I can play that game. So scientists are saying that wastewater epidemiology is like peering into a crystal ball in the shape of a toilet. I think that is right, correct?
That's what he said. That's what he said.
Okay, thank you. So, but is there any proof that it works? Any evidence that it works?
Yes. So, a couple of weeks ago, the University of Arizona had detected COVID-19 levels in the sewage of one of its dorms. And so they tested everybody in the dorm. And 2 students who were both asymptomatic tested positive. So they took those kids out of the dorm, isolated them, and they sort of view this as a success story in the sense that they see it as preventing what could have been a major outbreak.
Yeah, but I want to be clear. Is it 43 communities, when their wastewater gets to Deer Island and they detect the presence of the virus, they don't have the ability to say it came from this city or town, do they, or do they?
Well, so the Massachusetts Water Resources Authority, they divide this data between the north communities and south communities, and Boston is their largest customer. So they're able to get a sense in that way, but it's not at a granular level.
Well, but at a granular level, if that's what you mean, that's what Joe Cartatoni is doing in Somerville, is bringing it upstream. Is that the proper terminology? So that when he's doing this, so that is what he's doing, right? So that he knows if the virus is present in Somerville, right?
Right. So they're going to be testing at the manhole level. They're going to be opening up about, I think, maybe close to a dozen manholes, sewers in the city that are close to high-risk areas like nursing homes and testing the sewage in those areas.
So I only have a couple seconds left. Why isn't everybody doing this, Cristina?
Well, it is picking up speed, and there are more and more communities who are definitely starting to take a closer look and thinking, okay, well, this is something we need to look at and take seriously. So I think this is definitely Poop's moment to shine.
I was just going to say the same thing. It beat me to it. Cristina Quinn, only you, as they say. Good to see you. Thanks so much. Appreciate the report.